Hello, my friends. How are you guys doing? I hope you guys are having a great week and happy early Valentine's Day. For those of us who are still single, then happy Singles Awareness Day. Welcome to another episode of A Taboo Life, where everyone has a story to tell. I'm your host, Drew Franks, or Frank for short, and I want to thank you guys again for listening. Come check out the website ataboolife.com, where you can read some great articles, short stories, poems, and prose, because I am that sappy, and other episodes of the podcast too. A great example of which is the short story that was mentioned a few times during this episode, titled The Execution. It is a sci-fi morality tale about a man who's on death row for a crime he committed that may have saved the world. So check out on the website ataboolife.com, and if you like the episodes, the stories, and the articles, send me an email or leave me a little tip on the website. Alright friends, I want you to welcome Miss Sharon Schmidt. She is a midwife here in Jacksonville, Florida. She runs the Fruitful Vine Midwifery Service, and she's also a practicing genealogist. It was a great episode. We talk about the profession of midwives, we talk about genealogy and researching families, and we talk about why family and love is really important in life. I had a great time talking to her. Wonderful person to talk to, and I hope you guys enjoyed this episode. So here it is. Alright guys, I'm here in a, what would you call your center?
It's a birth center.
Birth center. I'm here in a birth center and I'm finding out what midwifery or midwifery is. So why don't you introduce yourself?
Sure, I'm Sharon Schmidt. I'm a Florida licensed midwife. Been practicing midwifery in the state of Florida since 1998.
Wow, 1998.
Yeah. Before many of you were born. Just kidding.
So we're talking for a little bit about midwifery.
Good.
Right? I said right?
Yeah.
It is probably one of the world's oldest professions.
Probably the second
oldest, right next to
yep,
the old
one. You go for that. That's another
the oldest
interview.
one.
Not with me.
So yeah, tell us about the history of midwifery.
No, seriously, historically, it is one of the oldest professions. It goes back to ancient Greek history. It's even mentioned in the Bible in Genesis, talking about midwife meaning with woman. A lot of people joke about men being midwives being with husbands, but that's not the definition of the word. Midwife is with woman. So during the process of delivery, historically, women have always cared for women in that process, be it somebody who's a professional midwife, either academically or
bring the mic a little bit closer to you.
Apprentice.
There we go.
Model, but even aunts and grandmothers and sisters, as long as she was a woman, she could help that other woman through the process.
What training is there?
Well, in the state of Florida, there are two paths to midwifery. There's the certified nurse midwife, who is first a registered nurse and then goes on to get her master's degree in midwifery. That is not the route I chose. Mm-hmm. I chose a Florida licensed midwife path, which is patterned after the European model of midwifery, which is known as direct entry. In other words, you don't have to be a nurse prior to becoming a midwife. It's a 3-year program in the state of Florida that provides the didactic training, clinical training, everything you need to be a midwife.
So, emergency training, medical training?
Everything. Everything that's pertinent to midwifery and the newborn care.
Mm-hmm.
So someone who is a nurse midwife to get the nursing degree would do all the different categories, if you will, geriatrics, pediatrics, maternity, emergency room. They would go through each of those qualifications. In licensed midwifery or direct entry midwifery, we're entering right into the midwifery model. We don't take care of the geriatric patients. We don't take care of pediatrics. We just focus on maternal care and infant care.
So what would be the benefit for each?
Yeah, for me, the reason I chose licensed midwifery versus nurse midwifery was the bottom line was autonomy. In the state of Florida, licensed midwife is not required to have a physician sign her protocols to practice midwifery, versus certified nurse midwives do have to be under the practice of a physician, an OBGYN.
Oh, okay. So you have your own... what you said, basically, you have your own autonomy with the way...
It's about autonomy. The minus in that is in the state of Florida, I'll say we're pretty lucky to have licensure, but the relationship between the OBGYN and the midwife has taken a while over the years. It's coming together where we can work together as a team and recognize that one or the other is not the enemy. We're trying to make birth safe for everyone.
Yes. So, for midwifery, I keep wanting to say midwifery.
Oh, go ahead and say it. I'll
midwifery. So, for midwifery, talk us about how a woman will go through the process of
Sure.
wanting to get midwife and midwife and the birthing process.
Sure. So generally speaking, she's pregnant.
Yeah.
Although,
step one.
although we do have women who come to us who are actually planning everything out. They want to know their options before they even conceive, which I think is pretty cool that some women think that far ahead. I didn't, but I think it's cool that other people do. So once she discovers she's pregnant, maybe she's heard a friend talk about her birth or seen The Business of Being Born, which is a Ricky Lake documentary that was done several years back. Or maybe she's seen a couple episodes of Baby Story and thought it was a neat idea to have a baby in an out-of-hospital birth experience. They would call us. Generally, if we can get somebody early, 8 to 10 weeks is a good time for a first visit. At that visit, we offer all the same labs and ultrasounds and, just everything that the OB world offers. I think the biggest difference is maybe informed consent. We think a little bit more about what that patient or client would want in her birth experience and allow her to actually make the educated decisions for herself.
Okay.
In other words, you can't make informed consent if you don't have information, right? And so given good information, I believe that the parents of that child can make that decision. So for a woman that's coming here planning out her birth, what happens actually when she actually starts going to labor? Does she just drive straight? You're skipping so much.
Oh, am I?
Right.
So go back.
So we do all the prenatal care.
Okay.
So she doesn't need to see a physician unless she develops some complication or risk factor. We do visits every 4 weeks for the first 28 weeks of pregnancy, between 28 weeks and 36 weeks every other week. And then from 36 weeks to 42 weeks, it's weekly, or until she has the baby. The gestational age of pregnancy is 280 days or 40 weeks. So 37 to 42 weeks is the window that she could deliver with us. If it's prior to 37 weeks, we would transfer her care to one of the wonderful OBs in our community. Or, of course, if it's after 42 weeks, we would do that as well.
Why is that?
It's our protocol, number one, but having a baby out of hospital isn't about it being a cool thing to do, although I think it's probably the best thing a low-risk mom could do for her baby and the safest thing. But to have parameters to keep it safe, I think is important. And prior to 37 weeks, there's a small percentage of babies who don't breathe on their own or don't do well. So I think it's safer for them to be born out of hospital. And then at 42 weeks, ACOG standards, American College of Obstetricians and Gynecologists, have defined that as post-term pregnancy, in which the baby is better out than continuing in because the risk of problem developing after
that's when cesarean section.
No, that would be the last option, but induction of labor.
Oh, induction. All right. So
now we can talk about birth.
Okay, now. So you guys do checks every 1 to 2 weeks.
Yeah.
Before we go to the birth part,
Sure.
How do you check for complications from a midwife standard?
So there are a routine that we do at each prenatal visit. Checking the blood pressure of the mother. We can determine if her health is stable. There's a complication called preeclampsia, which simply means before her means seizure. It's not super common, but to be able to monitor her blood pressure, we can determine whether or not her blood pressures are trending up and whether she is at risk for that pretty serious complication. We can monitor her urine with protein in the urine is also an potential indicator of preeclampsia and other things.
Okay.
Measuring the baby's growth by doing a measurement of the abdomen. We can tell growth from visit to visit. And making sure the baby's head down at the appropriate time in the pregnancy.
So
that's all we do, is all these things that we do to keep that woman here who's low risk only.
I'm trying to paint a picture in my head.
Oh yeah.
How do you measure the abdomen?
With a tape measure.
Also, that's it.
No, not that way.
Oh, that way.
He just did a circle of the abdomen. No, from about the pubic bone to the fundus or the top of the uterus.
Okay.
This way.
All right.
Yeah.
Yeah, sweet. So when
you don't have kids.
No, I don't. I don't have any kids. So when the woman's ready to give birth, what's the process of her getting here? And
sure, and we talk about that towards the end of the pregnancy. She's also hopefully taken a comprehensive childbirth class through the community. There's a number of them in the community that help a woman prepare for an out-of-hospital unmedicated birth. The woman is instructed to call, let's give us a heads-up call when the contractions are 4 minutes apart, lasting for a minute for about an hour, a 411. And that would be a first-time mom. Anybody having a subsequent delivery would be based on their previous experience. So it's very unique and individualized care. It's not a blanket statement you can make for anybody, even though the birth process is very simple. The uterus contracts, the cervix dilates, and the baby comes out of the vagina.
Yeah.
Yay.
Yeah.
That's it.
That's it.
But how that baby gets there and how all that works is very individual for someone.
Yeah, and how long it takes too.
Exactly. The timeline. Like the average labor for a first-time mom is 16 hours. And that's from oh, hey, I'm having contractions. And you do that for a while too. Here's the baby.
Oh, here's the baby.
Yeah.
So right now, is this a room that we would have
prenatal visits in this room, and also this is our secondary birth room.
Okay. Yeah, because I see the bed right there.
Yep.
Paint me a picture and paint the audience a picture of like what would happen in a room if a woman's giving birth right now.
So, first of all, I would say the majority of the women who come here, they're looking for something different as far as their coping mechanism for pain management. And we know, especially with hydrotherapy, it's used in sports a lot.
What's hydrotherapy?
Hydrotherapy, water therapy. You see it when you're watching the sports teams soaking themselves in ice water.
Oh, yeah,
warm
I do
water,
that sometimes.
yeah, exactly. that there is, scientific information to prove that it helps relax or cause, pain to go away.
Yeah, inflammation helps numb it down.
Pretty much everything. What's nice about using hydrotherapy in labor is the warm water helps relax the mom. Mm-hmm. There's a physician, Dr. Grantley Dick Reed, back in the 50s, who made an observation that's really continues to be observed to this day, and that is there's a fear, tension, pain cycle. And it's not just with birth. Anytime somebody's in pain and they become fearful, they become tense, the pain becomes worse, and it's a cycle that needs to be broken for that person to be able to come to terms with their pain, maybe, or to be able to transcend that pain.
Yeah, or have someone basically holding your hand.
I mean, seriously, that may be all it takes for someone.
Yeah.
And we're talking about birth, but we're not talking about birth. But so in the use of water or hydrotherapy, the water, I believe, stimulates the nerve endings, kind of distracts the body from that pain and helps relax the mom. So in a situation like that, very classically, a woman will come in here, as long as she's in active labor. We didn't go over the definition of that, but that's about 5 centimeters dilated. The cervix is open about 5 centimeters. That we would prepare a tub if this is the desire of that woman in her coping mechanism. So we would prepare the tub for her to get into.
And that'll be warm salt water or just warm water?
Just tap water, warm water, body temperature. You don't want it too hot because it can elevate the mother's temperature, also the baby's temperature or heart rate, because when our body temperature gets elevated, our heart rate increases. So you want to keep it kind of right around body temperature, maybe a little bit warmer.
And too cold, will that possibly hurt the baby by putting a shock? Or
when the baby comes out, you want the baby to stay warm, because regulation of body temperature is pretty critical for an infant. So
yeah, he just came out from a warm place, so it's
you want to transition that baby into a similar environment. So
let's say a woman's giving birth in here. She doesn't do the hydrotherapy. She just wants it straight. So she'll be on the bed and you help her give birth and that's it? Or
so
I don't want to say not that's it.
No.
Not that's it.
No, see, when you're asking, I know where you're going with the questions, but I feel like
like go ahead.
A better
go ahead, educate me on.
Keep her out of the bed.
Oh, why?
A woman anybody who's in pain, who's forced or recommended, strongly recommended, to lay in a certain position without movement is going to hurt more. First of all, they're going to sit there and think about how bad it hurts, and they're not going to be able to cope with it. And I think that that's part of the reason that women want to have a birth out of hospital is because they, in fact, have autonomy, right? They can get out of the bed. They can move around. In some hospital settings, they may be restricted to the bed and to strict monitoring. And let's just be clear, I'm not talking about high-risk women here. I'm just talking about low-risk, healthy young women, because there's certainly a place for strict monitoring for women who are high-risk.
Yes.
So if a woman comes in, she doesn't want the water birth experience or water hydrotherapy in labor, that's fine. Some women don't. We encourage her to be up and moving around, because in nature, that's what mammals do. They move around until it's time to push their infants out, and then they do it.
So you have her move around while she's giving birth, or
right
before, or just right before?
It's kind of like the dog who's having puppies. She's moving around, but when it comes time to pushing her puppies out, she's in a closet, in her cave, in her safe place,
where she's comfortable,
she's safe and comfortable, and knows her puppies aren't vulnerable. And we're not that much different.
No. I was trying to think. I remember, I know it's going to sound really stupid, but I remember I don't know why this came to my head while we were talking, but the Da Vinci Code, and there was a scene where they're showing Mary giving, or somebody giving birth back in the after Jesus died. She was standing up and on two bricks, basically two stones.
It's
on her
very
feet.
classic. Yeah.
What type of birth is that, or what's the reason for that?
Well, first of all, gravity. Second of all, the placement of the bricks is very historic. It's not something a movie maker made up. You can find that in some old writings, so it's not anything new, but it's the whole idea of being able to open the pelvis up, having the feet planted in a certain spot far enough apart that when she can kneel down or bend down, that pelvis opens up and allows the baby descent.
Man, she must have a lot of strength and endurance. Like, I'm going to stand here and do this.
Women are pretty awesome. I'm just going to say that.
Actually, when I was a police officer, we had to do taser training. And they all said, like, the instructors said, like, watch the men and watch the women, how they take it. All the women who got tased took it. They did not sing, they did not whimper, did not scream. Every man screamed, including me. I screamed like a bitch. I was like screaming, like, "Oh my god, this is horrible!" But all the women did not say anything. But do you have
video of this? Because that would be awesome.
There was, but it's a long time ago.
Okay. It's since been deleted.
Yeah.
Okay.
Yeah.
Well,
women,
no, it's true. Though,
yeah, women have a higher pain threshold than men.
I believe so. Maybe in a different way, though. I think, that we're designed for different purposes and for different things. So I think that, I can speak for, women in childbearing. Women are so strong. It's crazy how strong we are.
Yeah. Yeah, because that's
I mean, we have to raise these kids, actually.
Yeah, not only raise them.
Generally speaking.
It's like, okay, well, let me push this little human being out of my body.
Let me take care of the 3-year-old.
Get ready for this painful experience.
It's so much more than that, right? Yeah.
What protocols do you have in case of a complication?
Sure.
Something that you didn't foresee until the baby came out.
Right, and again, qualifying that we see low-risk women, healthy women, doesn't mean things can't happen. So we're always on our guard.
Yeah.
Always keep oxygen turned on for the baby. Have what's something called, you're probably familiar with an ambu bag. It's a way to breathe for the baby and open up the lungs. 2 of the people at each of the births are trained in neonatal resuscitation.
Oh, wow. Okay.
So if a baby comes out needing some help, we're there to assist the baby to get help breathing. Again, because we have low risk healthy women that aren't doing drugs or taking drugs during their labor, very rarely do we have babies who are respiratory distressed at birth. It happens. That's why we're trained.
That's right.
So. And as far as the mother goes, we're monitoring her blood pressure. We're monitoring her temperature. We can see her. We can see if she's in any kind of distress. And we listen to her. She will tell us everything we need to know, and we can get that other data with the blood pressure and the temperature, for instance, to be able to make sure we're staying here with a safe, healthy, low-risk pregnancy. So if something develops in that case, and there are what I would say obstetrical emergencies that can happen to anybody anywhere. If they happen to occur here with us, good news is we're trained to deal with those and recognize those where we would in a 911 type emergency call rescue and have her transported to the closest hospital.
Yeah, you'll be able to stabilize her before
Correct.
the EMTs come.
And the good news is because of our clientele, we don't have those experiences frequently. We will transfer care for someone who maybe she just didn't prepare well enough and she just needs to sleep or needs medication to get epidural or something along those lines. I'll transfer for that if that's what she needs. I'm not opposed to that. I think it's a good tool in many cases. If her water broke and she's not in labor after a certain amount of time, and that's dependent on what pregnancy it is for her, we'll take her to the hospital so that she can get an induction and get that baby out safely. Because at the end of the day, it's about healthy moms and healthy babies.
Yes.
I just happen to believe that the birth experience is equally important. In other words, a woman having a positive birth experience where she's in control of the decision making to the extent that she can, and the health of her baby and herself are right on the same plane. There's not one more important than the other. But if one's going to come down a notch, it's going to be the birth experience. Mm-hmm. Because at the end of the day, moms just want their babies, you know.
I mean, it's a holy experience in a way, or a sacred experience.
I was going to say holy in both sense of the definition, with the W and without. It's a very spiritual experience, and I find that, and not maybe that needs to be defined, but not necessarily a Christian experience, mm-hmm. although many women do have that approach to it. But I think it's very spiritual.
Yeah, it's spiritual
for any woman, whether she recognizes that or not.
I remember back in college, they did a study about men when they first hold their child for the first time. They were taking samples of testosterone from men before, mm-hmm. and then right after when they held their child, and they found out the testosterone was dropped dramatically.
I believe it.
So even though men are not giving birth, men are there too. Like, oh wow, it's my baby.
You know, it's interesting, and I don't. If I'm going in a different direction, I apologize.
No, go ahead.
But you brought it up. That historically, men have not been part of the birth experience.
Really?
That from, the beginning of time, it was always women helping women. That's why today, when you think of a midwife, you think of a woman. Mm-hmm. Although there are some amazing men who have, become midwives, that's not the population of midwifery. It's typically women. But, it's just been recent history that men have been, air quotes, allowed, to be there when women are having their baby. In fact, biblically, it was against Levitical law for a man to be around a woman when she was, when there was blood. So menstruating or... Yeah, and I kind of think, I don't want to be sacrilegious, but I think maybe God was just trying to figure out a way to keep guys out of the way, because as a rule, there are rescuers and protectors, mm-hmm. and, if she's having a baby, she doesn't need to be rescued. At all. And so he's like, okay, how can I keep guys away from her? There'll be blood. That's it. She'll be unclean. And people think, oh, God hates women, because they're unclean. And I'm like, no, I think he likes us because he kept the guys away from us.
Now, I think because a lot of stuff in... Why no, I completely forgot the chapter. But a lot of stuff in the Bible, when they say like, oh, this is a sin, they may have called it a sin because it might have been a health factor. And
absolutely.
Because they didn't know about germs or medical or current medical terminology or care. Like a good example is the whole do not mix milk in the wooden bowl where you put your meat. And they said that's a sin. And then when you look at it, it's like I think they call it a sin because people were getting sick from it because they're mixing the bacteria up.
Right. It was a law that was meant to be followed to keep you safe.
Yeah.
Yeah.
Because they could explain it. It's like, oh, well, this is a sin. And it's probably with good intentions why they're saying it's a sin. So it's probably the same thing, too, with the whole men still be around women when there's blood.
Right.
And plus, women obviously know more about the female body than men.
Not to get into too much history, although I enjoy history.
And we'll talk about that in a little bit, too.
I know, right? In the 1700s, 1800s, men started becoming involved in birth in Europe, and women were dying horrible deaths.
Oh, okay, keep
Horrible.
going. I think I know.
Yeah.
I know where
Horrible
you're going.
deaths. A physician in Austria, Dr. Semmelweis.
Mm-hmm.
Yeah, he said, "Hey guys," I don't really know that he said it this way, but I can imagine he was like, "Hey guys, I think it's us," and he probably, and it did, in fact, get shunned by his colleagues. He was trying to propose that perhaps we, the male physicians, were introducing disease to these women and causing their agonizing, horrible deaths, and the children too. And so, people ignored him, and in fact, he died before the theory became proven. There was a American physician, Dr. Oliver Wendell Holmes, who said, "No, really, this guy was right. It's us." What was happening in Europe is men were dissecting cadavers.
Yeah, for training.
Dead bodies. And remember, they didn't have latex gloves or running water in the olden days.
Or
and they
any
would
type of antiseptics.
nothing. Antibiotics, nothing. They would rinse their hands in still water and go to the next room, presumably sticking their hands inside of a woman. Maybe her water was broke. Introducing now bacteria from the cadaver into this mother's body, and causing, seriously, the most agonizing death there could be, which is puerperal fever, or basically infection. Moms and babies were dying in numbers that were unheard of. And it's during this time, by the way, that the Bible was being translated into different...
languages?
Not different languages, but different versions of the Bible. So like the King James Version, I think it was like 1611. This happened after 1611. And it's interesting that in the Genesis account in the garden, that the words for pain and labor were translated sorrow in the King James, but in other translations it was now pain. And I think it might have had something to do with the translators at that time were watching these women die horrible deaths, or dealing with labor.
They changed one word because what they were witnessing.
Exactly. Well, what's really interesting about this whole thing is in Levitical law, first of all, we know men weren't supposed to be around women because they were unclean. 2, there's a law that says if you handle a dead body, you yourself are unclean for 24 hours. And then there's talk about when you wash your hands, to wash your hands in a running brook or a river, that the water has to be moving. And while to you and I, that seems like, really, it's a no-brainer.
Yeah.
No, for them at that time, it was just fantastic information, almost unbelievable information. So instead of rinsing your hands in the bacteria-infested waters,
blood water,
and God knows where those hands were going, they were violating a couple of Levitical laws that really could have saved a bunch of women. And maybe the Bible translations would have been different from that point on, too. That's a whole nother podcast, by the way.
Yeah.
Seriously.
But like, that's actually one of my favorite historical stories, though, because it shows about a man who's like he was a man of his convictions. They thought he was freaking crazy. He was institutionalized a couple of times because they thought he was crazy.
Psycho. Yeah.
And because this is before germ theory came out. I forgot what he called them. He didn't, because they didn't know about bacteria or germs. He gave them, I think he gave it a specific name. But the way he sanitized, he used I think Clorox, not Clorox. What's the main ingredient in Clorox? It's bleach.
Chlorine.
Chlorine, yeah. He used chlorine to sanitize his hands, and the only reason why he did it because he liked the smell of it, and that
does smell good.
It's like he thought it smelled clean, but that killed everything on his hands. So his thing about like, oh, this smells clean, let me use it, actually was to start sanitizing.
Yeah, that's interesting though, isn't it?
Well, yeah, that's one of my favorite stories because like it really is.
Yeah, I saw you light up when I was bringing it.
Yeah, because like it really is about. It's weird because it's one of those situations like we look back now in hindsight, you see, and there's always parts in history, like there's people in history that they knew more than anyone else, but they didn't have the definitions or the technology to explain it. But it's like they knew like, hey, I'm right about this.
I don't know how to explain this, but I'm right.
I know, right? This is the evidence I have so far. We just can't explain how I got this evidence, and they are called charlatans. They're called insane.
Yep.
Yeah. And 50, 100 years later, like, oh, wait, this guy should have been given a Nobel Prize.
Yeah.
He should have been given.
And now it's like he's a hero.
Yeah.
You know?
Yeah. And it's sad because he died. I think he died as a labeled as a crazy person.
Yep. Exactly.
So, how did you get involved with midwifery? What was the story behind that?
Oh, wow. It's a good one.
Midwifery. I said it right.
You did. I didn't have to correct you. That's great. No, after our first baby was born in a hospital, and we were very young, and we did do a Lamaze childbirth class, but when the time came and I was offered drugs, I was like, oh yeah, let's do drugs. But had drugs, all the bells and whistles. Back in those days, you stayed in the hospital for a couple of days. You have your healthy baby, and I thought it was the most amazing thing because here I have this baby, and I was so happy. And then 2 years later, same due date, I had an out-of-hospital birth with our second son, and it rocked my world. It was the most amazing experience, and I don't mean it wasn't painful, or there was something in it that was, just made it, I don't know, a better word, supernatural or anything like that. No, I worked through it. It was hard. But it was after the fact, when I had him, that I was able to not only stand up and walk on my own, but just experience the endorphins and the, just the natural experience. It really connected me with that kid. In fact, every time he has a birthday, and I call him up to wish him a happy birthday, he'll remind me that was the day I became a midwife. But I just knew I had to find a way to help people the way that my midwife helped me. And I wasn't sure what that meant because that was 2 years after our first kid, and we were still really young, struggling young couple with little babies. But 16 years later,
you have this nice little practice,
and I'm like, and well, I didn't have it then, but now, yeah. But so I will say that birth changed my life. 3 months after he was born, there was a gal in the church I went to at the time who was a single mom, no partner, and the church secretary was like, I know you had a positive birth experience, maybe you can help her. And so I did. And that was the beginning of it, helping that woman as her doula.
What's doula?
I knew you were going to ask that. Doula, it's a Greek word that is used as a labor support person. Mm-hmm. So they offer emotional support for women. It's not medical at all, but informational, emotional, and practical, like rubbing their back or different things to help get the baby in a good position, and kind of work as a companion in the birth team. The doula, the midwife, they all work in a certain area. Mm-hmm.
So she'll be the one basically holding the hand.
If you want to just minimize it to something
I don't want to minimize it, but like...
Yeah. No, I think...
the emotional
there
hand.
are many roles that a doula would assume, but that very possibly could be one of them, just simply being there with her. So...
Is the father usually in here when the baby's giving birth? Or they
I'll
are?
say 99% of the time. Yeah. There
All,
was that one time. No, I'm just kidding. No, there really was that one time, but we won't talk about that.
okay. All of them have the same face, like the shock look, like, oh my god, baby's being born?
No, because just as, oh my gosh, just as there are, sand at the beach, we're all different. We all have our own, experience when it comes to that. And I've helped women have one couple I've helped them with all their babies. They have 14. And, I've watched the dad, with each of them. And it's just kind of special. I mean, there's still that, even number 10, number 11, whatever, that kind of, this is my kid, get teary-eyed, but also just kind of melt with that baby. It's kind of cool. Some guys are real tough, prenatally, and then to watch them with that baby, it's so sweet. And then you got the guys that are just tough, and then this tough guy holds this baby, and he's, you're like, you're gonna take care of this kid.
Oh my god.
It's pretty cool. You can see so many different, even in the same guy, so many different faces. So it's a cool experience.
One of my best friends, he had a child almost 2 years ago. His wife was telling me, like, because we all were taking bedside, we thought he was going to pass out.
Yeah.
Because he was in the hospital room with her. And she said, like, no, he was surprisingly calm and supportive. But then I was talking to him, I was like, man, I was freaking out. I was like, oh my god, it's a baby.
I will not mention any names, and I probably won't tell them about this podcast. But a good friend of mine, and they've become friends over the number of babies that I've helped them with. Mm-hmm. But after the first birth I did with them, which was their second baby, they have 10 now, I think. Anyway, he warned me. He said, I get very, in the sight of blood, or not even blood, just not birth, but any kind of
bodily fluid.
Yeah. Don't throw up around him. He'll probably pass out. And he did warn me, and I was just like, nah, And so his wife talked him into cutting the cord. The little 2-year-old was there at the home birth, and Daddy was going to help him cut the cord. And he did such a good job. And you're like, yeah, you did that. He leaves the bedroom rather. Apparently he went out front, passed out in the front yard, comes back in. He's got dirt on the side of his face. And we're like, dude, Chris, what happened? Out. And he's like, I think I fell asleep. And I'm like, I think he passed out. So anyway, and he did that twice, in 2 incidences with his children, so it was kind of fun. But no, nobody else has. But it's common to make the guy that person.
Yeah.
I don't see it happening. And those who think they will, you're just like, just stay right up there by her head. You'll be fine. Sit on the bed. Make sure he has a good landing pad just in case. But nah, it doesn't happen that frequently.
Do you have a birth that stands out to you, like your favorite birth that you've done?
Gosh, I'll say there are. That's so funny. One just flashed in my head, but I have probably a top 10. But there is one birth, and the thing about her birth was probably a connection that I had with her. This particular mama. Her name's Holly, and she would not mind me saying that. I've known her since she was a child.
Oh, wow.
Yeah. And in a past life, I worked for an eye doctor, and her family was a patient there. And I taught her how to put her contacts in when she was 9, Watched her grow up. She had 2 children, and then with her 3rd child, she was back in Jacksonville and wanted a home birth. Her mother was there. Her best friend was there who... Sorry about that.
Okay.
Hello, little thunder. Who had babies with me.
Go ahead and bring
later.
that a little bit back to you.
Back to me.
There we go. Okay.
And a little technical difficulty. Anyway, so she was well supported. And she was having a rough time at the very, very end, which is pretty classic transition.
Ooh, there goes that ant.
It's the one you didn't get earlier. Anyway.
Okay.
So, when she was having her little struggle, she was in the birth pool. And I just remember leaning over, and I basically put my head on her shoulder, whispering in her ear, that it was going to be worth it. And just to breathe through the contraction, and had my hand down there ready to catch her baby. I didn't even watch. Just her baby came out into my hand with me just whispering in her ear. And it was just such a connection with her. And I think it had to do with the relationship that I had with her, which is really part of the midwifery model. But that was a bonus because I'd known her for so long, 20 years of her life.
Wow.
But, that's really a big part of the midwifery model is relationship. And if you think about it, culturally in the world, the midwife is the woman in the neighborhood everybody knew. She's the woman who raised her own children, had gone through every aspect of child rearing. Infants, toddlers, school-age children, teenagers, watched her own children give birth or have their own children, and were grandmothers. They took care of people when they died. They took care of people when they were being born. They were an integral part of the community. And so everybody knew who they were. So I think that's what made that one stick out so much for me.
How come? I think it might mean hospitals might be the answer to this, but how come midwifery is not midwifery?
I thought I had you trained.
Yeah, I keep wanting to go back to the original, the way I thought
Midwife.
it was midwifery. How come midwifery is not as popular as it once was? Or is it still at the same?
Well, I think there's a resurgence in the midwifery model. I think what we have in our culture, that's what we're comparing it to, but in Europe, little girls grow up to either be teachers or midwives. It's still very prevalent. In the Netherlands, Holland, the midwifery model is the primary model of birth. That's you have your baby with a midwife. About 80% of the population does. The 20% who are high risk go to the surgeon, the OB. Not necessarily to have a surgical delivery, but because they require closer monitoring.
Yeah. Then you have the hospital right there too, so if there's a big complication, solve it right there in the moment.
Yeah. I mean, come on. All eyes are on Prince Harry's bride. She's pregnant. She's having a home birth. She's got a doula. Hypnobirthing or whatever she's doing. Yeah, I'm excited about that. Now, Kate Middleton, she had unmedicated births with midwives, but in a hospital setting.
Okay. Man.
I know, right?
Must be like a weird... Like, imagine you're the midwife assigned to that. Like, you're the princess. Right? You're a princess.
Well, and I think that, those are... Anybody who cares for the royal family, I mean, they've got to be handpicked,
It's probably be
groomed,
It'll probably be the same way like a president's wife was giving birth and she wanted to do a midwifery. Have a midwife. They'll probably do the same stuff.
White House.
Has there been? I don't think there's never been a pregnant first lady in the White House, right?
Yeah.
There has?
There has to have been, right?
No, because I don't think so. No,
Yes. Jackie Kennedy. She had
was she
babies.
pregnant while
Yeah.
he was in the White House?
She had losses. I know that. Mm-hmm.
Oh wow.
Mm-hmm. I don't know. Y'all don't quote me on that.
Yeah, I gotta look that up now.
You did not warn me about that question.
No, I just thought about like where's
Actually, you didn't warn me about that. There's that.
All right. So you also do. We were talking about this before when I was setting up, and I want to keep it organic and raw. You do historical work, not historian, and I want to say gynecology for some reason, but genealogy. You do genealogy. So tell me a little bit about that.
You're gonna bring in my other life.
The gynecology. I want to say gynecology for some reason.
Spelunking. That's a joke. Okay. Anyway, I digress. Yeah, family historian, genealogist. That is my hobby that I've now branched out and starting to get paid for. Yeah. So, my mother's family is from Alabama.
Mm-hmm.
I love Southern families. Every time we would go visit my grandmother and her parents, my granny and granddad, every time we would go down there, we would go to the cemetery. You'd walk to the cemetery. It was right there in Cottonwood, Alabama. And I don't know, when I was a teenager, like 13, 14 years old, I was just so intrigued by who are these people I had never met that they feel so compelled to pay homage to every time I went there. And it was pretty impressive to me. And the elderly people would sit on the porch, my granny and granddad, my granny's brother, they all lived in the same little cabin, no running water. They did have electricity. But all the siblings would come and just sit on the porch and talk about the past and talk about life. And I don't know, I kind of like you, how you want to tell everybody's story. I feel like that's something that we miss in this busy world that we live in. We're not stopping and listening to people's stories.
Yeah,
you know?
It's
very passionate about that.
Yeah, like I was thinking about the other day, for long term trying to preserve these interviews, because I know some of the interviews got really intense, like a good intense.
Sure.
And like I think one day, like the person I interviewed may want to let their kids listen to this.
Mm-hmm.
And I was thinking more about that, like, well, about my family. So I started thinking about my grandfather, great grandfather who I never met.
Mm-hmm.
I only heard some stories about him.
Be careful, I'll be doing your family research.
I might get you to do that. But my great grandfather on my mother's side, my grandmother's father, he lost his leg in Puerto Rico, but he lost it saving people's lives. He was in the army in Puerto Rico, but he was only a Spanish speaker. Mm-hmm. So he was stationed in Puerto Rico, and they sent him out during a bad hurricane, and he had to he used his body, I forgot exactly what happened, but he used his body to shield this family, I believe, because the wind. I think he went on the roof and covered the roof of his body, and I think he had a bad cut on his leg or a bad injury, and ended up getting gangrene, so they had to amputate it. But he lost his leg saving people.
Wow.
Now going back to what you said, it's like, what happens if I never heard that story? And this, me personally, I think there's probably people in my family who I never, probably did amazing things. I have no idea who they are.
Well, so what's interesting is, I don't know, I solve puzzles, I solve mysteries, I find people. When I'm doing research, I want to do it right. I see so many errors on different people's family trees that people just make guesses, or there's Susan Smith on a census 2 counties over with the same year birth does not make her that daughter. You know, you need to prove that that's the person. You can't just make educated guesses. It's that serious because you don't want to link yourself up to the wrong family. So I take pride in knowing about not just my family, but even the families that I research for other people. I feel like I become part of that when I do the research. But one of the most interesting things that I'll say discovered was in my own family. My granny and granddad, the ones I'd mentioned that live in the cabin, my granddad, his last name is Bradbury. He was from...
Ray Bradbury. Like Ray Bradbury?
Wrong spelling.
Oh, wrong spelling.
But I wish, right? For real. No, Berry.
Oh, okay.
Yeah. And they're originally from Georgia, moved to Alabama and Florida, right there where, just south of Dothan, Alabama, there's a tri-state area. Georgia, Florida, and Alabama kind of come to a tri-state area. But they ended up in Florida. My three-great-grandfather was Benjamin Franklin Bradbury, which many of the Southern people did lots of naming after presidents or
historical figures.
I know Benjamin Franklin is not a president, but I was thinking of Andrew Jackson when I said that. So. But anyway, he was born in 1840 or about 1840 in Georgia, living in Forks of the Creek, which is right outside of Cottonwood, Alabama, but it's in Florida, Jackson County, Florida, in the 1860 census. And there's three families that live right amongst this. They're all farmers. There's the Rivers, the Bradburys, and the Peacocks. So the Benjamin, he in 1960 he married Harriet Rivers. She was quite a bit younger than him. I think he was 19, she was 14. And when the war broke out, let me back up, because they got married in 1860, had a baby in 1861.
Go back to the mic a little bit. There we go.
A baby in 1861, John Bradbury. And then the war broke out. He signed up for the Confederate side, state of Florida. And in September of 1863? Don't quote me on that. But there was a battle in Georgia, Tennessee border called Chickamauga. And second to Gettysburg, I think it was the bloodiest war. On September 18th and 19th, or 19th and 20th. And he died on September 19th, 19 years old. Got killed in that battle. Took a while, I'm sure, for the information to get back to his wife and to his family. Not too long after that, also two of her brothers were in that same battle. They were in that same regiment as he was. One of them got sick and died. The other one returned home. And when word got back, one of the Peacock boys, Solomon Franklin, a.k.a. Frank, signed up, and he came back from the war. And when the war was over in 1865, he came back home and married Harriet. So, Frank married my great-grandmother and raised my great-great-grandfather, John, as his own, but never had him change his name. He kept his Bradbury surname. And my mother had always told me about, somehow we're related to those Peacocks. And that was the story behind it. It wasn't just we're related to some of these people. No, Frank Peacock, when he saw that the neighbor kids he grew up with dying, he went and replaced them. He went and took their place, so to speak.
Wow.
And when he came back took care of his friend's widow and raised her. Well, they had 15 children, but
oh my God.
in addition to John,
15.
but hello. So it's maybe more. No, just kidding. I'm not going to lower her to
15.
that standard, but no, she probably had a midwife too, but there's that. It's just interesting, and nobody knows that story, but I put together that story to tell my family.
How'd you find that out?
Oh, research.
Mm-hmm.
I went up there. I went to the actual battleground. I went to the field where he died. It's all a national park. But I had one of the park rangers looked up his name, looked up what field he was in, and gave me a map and said, I can't tell you the exact piece of ground that he died on, but he died right here on this person's front yard, pretty much.
Wow.
Yeah, and it was talk about just walking on that ground and going, wow, this 19-year-old kid, died that day. It was pretty amazing. But stuff like that really, it kind of fuels me. I just think it's pretty amazing. Went up, did my husband's, of course, done my husband's genealogy, and his father's family came here in 1900 from, Lithuania, Russia. They were all the same, that country. Poland. And they came through Ellis Island. So don't you know, I wanted to go to Ellis Island. These people are not blood related to me. Mm-hmm. But to be in the registry room, knowing that this is the place that his family stepped in when they first came to this country, it just gives you goosebumps, to think this is pretty special. And the first time I went up there, forget how old Oliver was. It's our oldest grandson. He was probably 3. And he was with us, and like any 3-year-old, he was just running around like a crazy kid and just having fun. And I had my camera with me, and I snapped a picture of him running through this registry room, which is just a fantastic photo. And just thinking that his great-great-great-grandfather was not running through that room necessarily, but I've been walking through that same room. This is pretty cool. I love it.
When you went to the registry room in Ellis Island, is it just a museum piece, or is it actually a room you can actually do research in?
Well, in the bottom story of that building is a museum, and it's absolutely amazing. Talking about the different immigration processes, like Ireland, during the potato famine, and even though Ellis Island was only active, I think it's like after 1892 is when people started coming through there. But the whole process about, I think they're given like 10 seconds to look at this person and to see if they look healthy enough to enter the country. If they didn't, they were given marks on their clothing and chalk, sent to another room where they were seen by a physician, inspected, exactly. And there was an infirmary, a hospital, if you will, on the island as well for these people who weren't well enough to enter the country. It's fascinating.
It is fascinating.
The whole, immigration idea of another world for these people.
Yeah, my one of these books, I didn't read it. I listened to it as an audiobook. It was called Renegade History of the United States. Basically, the historian talked about not so much the famous historical figures, but like the culture at the time and what the people were doing. Yeah. Not so people that were important in changing the United States, but you don't hear in history books or read in history books. And they talked about one thing I thought was fascinating was when people came to America, immigrants, there were white people that were just upper class, and the Irish, the blacks, the Jews, the Puerto Ricans, who weren't classified white, and Italians too. And So at the time, everyone lived in like complete harmony. Like they lived in these neighborhoods and these ghettos, but everyone was friends or families. And this is one of the main reasons why you have a lot of African Americans with Irish last names is because of that.
Right.
Because they were married each other.
Yep. My maiden name is Gallagher, Irish as the day is long.
Irish.
It's true. My father's grandmother immigrated here from England. She was Irish.
Mm-hmm.
Her parents were from County Cork, Ireland. They had moved to London, where she and her siblings were born. She came over at the age of 16, and I always heard, and I remember her, my great grandmother, from when I was young. But I'd always heard that she came over to be a servant.
Mm-hmm.
Oh no. The thing is she didn't come over to be a servant. She came over to take care of her aunt's family.
Mm-hmm.
Her aunt had died. Her mother's sister died. And she came to help raise the children.
Oh.
That's quite a bit different. Yes, she was a servant in their home, but she was their family.
Yeah, she wasn't.
So
yeah, she's not a servant.
Right? And so, you get this story and you're like, oh, she came over to be somebody's servant. That's cool. No, she came over to take care of her family. So when I find her in the 1900 census, because she came over in 1896 and came into Philly, she is living with family members. She's not listed as a family member. She's listed as a servant. But in my research, I figured out that's who they are.
Why would they list her as a servant? Was it just a clerical error, or?
Well, if you think about it, the census worker would go do an interview,
Mm-hmm.
and whoever answered the door would answer the questions. I don't know who that was. Maybe it was the 10-year-old child who lived there. Maybe.
Oh, okay.
I don't know. And it may have been, just how they classified her, because that was her role in the home at the time, is to take care of the children, even though she was kin. So it was pretty interesting.
Interesting.
Yeah.
So how did you start getting paid for this?
Wow. So I went, I make a joke about this all the time, but I don't do crack. But I don't. But I always equate what it must be like to be addicted to drugs.
Well,
having to have drugs is having to have something to research.
Mm-hmm.
And so, seriously, I joke with people, if I sit here long enough and I get family names, I'll spend all night researching
what's going on?
And then I had somebody say, no, I will pay you to do it. And I just didn't think that was right. I mean, you could give me the genealogy, the drugs, for free,
You're like, you're just interested.
I don't have to pay you to give it to me. No, I'm joking, not joking, because it's that powerful to me to preserve that, But that's how I started getting paid. It was just maybe about 5 years ago. A friend of mine, she said, I want to hire you to do this.
And that's how it started.
Yep.
Ooh.
It's pretty fun. And the other thing too is I do a U.
Mm-hmm.
It's not a podcast. Maybe it should be, but I take my little recorder
mm-hmm.
and I'll go to the old hometowns of people and sit down and just ask questions of the elders in that community or the elders of that family.
Ooh.
And
yeah,
I have some recordings.
You should do it.
I know I do it. That's.
I mean, you should do it as a podcast.
That'd be crazy.
I mean, I think for that one you have actually have to do editing, but.
Oh yeah, I would, because.
This program I use.
About rambling.
Well, this program I use for Audacity is pretty simple. Well, it's not simple, but it's pretty user friendly.
But Frank, I have a Mac.
Oh, okay, you have. Well, no, dude. I think they have Audacity.
I'm messing with him, y'all.
Yeah, because my computer is
It's not a Mac.
It's a Dell. And my thing is like
Do you
I'm
have
not
to pay them.
No, I don't pay. No one pays me yet, but my thing is like it maybe in the future
Yeah,
when I
they
get the
could
money.
sponsor you.
Ooh, sponsor.
Apple.
Not there yet, but one day
You could do it.
No, my thing is like if it works, it works. I know for equipment wise, I want to get a little bit more portable instead of the stuff I have right now. Like probably better mics to basically I want to function out of a backpack with this
That would be
equipment.
ideal,
So
right?
something with less wires and less little bit less bulky equipment.
But it looks cool.
Yeah, it looks cool, and I like taking pictures of it when I do the pictures for the episode.
Yeah.
But yeah, I want the whole goal behind this. Like, I really want to travel the world one day and just get people's stories. So I want to do that out of a backpack.
Wow, maybe we could do something. I could do their genealogy and
Yeah, like well, I a couple of interviews I got that were really interesting were from other people I interviewed. Like, hey, I need you to interview this person. Like, they're really cool to talk to. Like, one of my favorite ones was her name is Sailor Cher.
Mm-hmm. I actually listened to that.
I loved her interview.
Oh my gosh,
she was
she's
fun.
amazing.
She was a cool person. When I get the money, I am gonna go back there and get a tattoo from her.
I was gonna say I want to go get a tattoo.
Yeah. Well, I got 3, so I got this one.
Oh.
And then
You'll have no idea what that says.
my favorite historical figure.
Really? I like the shades on Lincoln.
Yeah. Originally, I was going to get a different Abraham Lincoln
Yeah,
tattoo.
he's showing me his tattoos.
I was
Not
going
that
to get
one.
no.
Sorry, I went there.
No, I only had 3 done. One's on my shoulder blade. But well, I was originally was going to get a completely different Abraham Lincoln tattoo until the tattoo artist who did both my arms, she saw a picture on Google of the one I have.
Yeah.
It's like, you need to do this one. This one's way cooler.
Yeah.
I like,
It
yeah,
is
let's
cool.
do it.
I like
Let's
it.
do it.
Speaking of tattoos and history, family history, this whole arm is a family history.
Mhm.
But my granny who lives in the log cabin. See that word right there?
Mhm.
Corn.
Yeah, I see
See,
corn.
corn. That was from my granny's grocery list. Showing you my tattoo. This one right here, the hand holding the pen. My grandfather was an artist.
Oh, wow.
In World War II, he did nose art on tanks. Like, they did nose art on airplanes.
Yeah.
He did it on the
that's
tanks.
so cool.
Yeah,
I love those.
He designed the logo that's a tiger with the tank tread in its mouth. But he was writing letters to my father. And this was a doodle in one of the letters he wrote my dad. And it said, here's a picture of your hand holding a pen writing me a letter. And the dad that's right here, it said Dear Dad, but I put love here. And that love that's tattooed on me is from my father's letters to his mother when he was 21 and in the Navy.
Ooh.
So that's my dad. That's my granddad. That's my mom. She was happy about that.
Yeah, I'm going to take some pictures. Would you mind if I take some pictures when we're done so I could put it on the...
Oh, I think that'd be great.
Yeah.
Kind of explain what we're talking about.
Yeah, so
like,
people...
what are they talking about?
You can check out on the website and it'll be on the Instagram page.
Tattoos.
But yeah, I don't know, people's stories are important, especially in today's world. With social media and how you see in the news how people are treating each other.
Yeah.
I think a lot of problems can be solved if you just sit down and just like, all right, let's table the issue for the moment. Just remember, we could both listen to each other's stories for a few minutes. Like, okay, then go back to try to solve the problem.
Well, I think that when we get to know people on a more personal level, and this can go back to midwifery too, is if you know somebody and take the time to get to understand who they are and why they are, then you understand their actions. And I think that instead of being so quick to judge somebody by how they look, the things that come out of their mouth just on a whim, how they dress, all those things, it's nothing until you get inside of their head, and just learn more about that person. But probably even more important is, man, when that person takes their last breath, if nobody's gotten their story, they're gone.
Yeah.
You can't go back and get their story.
And also, there's also a harsh reality with that too. That some people never created their own story. Yeah. Never wrote. Like I know this is going to sound harsh, but once in a while I get emails. I'm like, hey, I want you to interview on me. And then when I ask them about who they are, and I feel bad. It's like you like, okay, one, you kind of want the limelight, and two, it's like you didn't really do anything. And I know that's bad to say, but it's like you have a life. I'm not saying like you have to be rich or famous. Just do something that you love, and that will show up. That show a lot.
That is the proverbial hitting the nail on the head to me, is finding your passion and do it, as long as you're not hurting someone else, or tearing something down that, somebody else built. I don't know. You know what I mean? You want to, just be passionate. I don't know. I think that's how I feel about midwifery. That's how I feel about preserving people's stories. I just think it's so important.
Well, it's kind of interesting because you're doing you're there at the beginning of one story.
Oh yeah.
And now you're going back and trying to find like the stories that have been ended. Like, okay, let's try to find them before they get lost.
Yeah. And I think we've also lost a lot of tradition and a lot of
there's a lot of tradition missing.
Culture that's missing. I had a family. Have a family who they were from Korea, and when they were naming their children, they gave their children a different last name, which you can do. If you have a baby, you can name your kid anything you want to. It doesn't have to be your surname, anything you want. And they didn't give their babies their Korean surname. And I asked the dad about it, and I was like, why? Because ironically, the surname they gave them was Chinese, not Korean. And yeah, but it's what was interesting was his reasoning behind it, because our last name is too difficult, 2 letters, but too difficult to pronounce in English.
What was the name? Do you remember?
I'd rather not say because of HIPAA, but
oh, okay.
It's not even the point. They had to correct people every time somebody mispronounced it. And so they're like, the Y is silent, or whatever letter it is, but then they took a surname from a completely different culture and said, oh, that's what our kids' names are going to be. And I'm like, I would fight for my name,
Yeah.
But that's my passion with family history and whatnot, that it wasn't worth a fight for them. And I just kind of got sad when they named their kids something different and basically burying their family history. Now, this was done a lot when families came to the United States, especially Polish families with, Russian families with consonants galore in their name. They would drop half the name, and just to make it easier or simpler or Americanize it. I love those challenges. Just recently did some genealogy for somebody, and he's like, I'm pretty sure this is not the name we started with. Go for it. And I'm like, you're right. It wasn't the name you started with. So, and there's different reasons for doing it, I suppose. But I guess part of it makes me sad because I love the diversity of our country, and how, just the names, like I said, traditions and cultures and things like that, I think are important. It makes the United States what it is.
Yeah, I'm trying to remember. I think my last name, because when my family went to Ellis Island, if I remember the story from my dad's side of the family, it was spelled differently, it was pronounced differently, and I think they Americanized it, and also too for some reason,
classic.
my last name is Portuguese. So it's like, oh, I wonder what the story is with that.
And there's another thing too, especially in South America, Portuguese. That traditionally you have so many different surnames because you always add the mother's maiden name. There's always the stacking of the surnames, which is very interesting in how they drop off throughout the generations, but they continue to homage for the woman's side of the family. It's pretty interesting.
Yeah, remember I was taking a couple Arabic speaking classes.
Nice.
And that was interesting about the surnames. Well, bin means son of. Was it ban? I forgot the feminine version of it, but I know they do bin, son of, bin.
Yeah.
That's why there's a lot of bin names.
Yeah. Yeah, that's exactly what it is. And I mean, you go back. That's like one of the lines in my family. You go back. There are no surnames. They're just first names because you lived in 1060. You lived in that culture. You were Matthew. You were the only Matthew.
You were the only Matthew
in wherever you lived. Yeah.
There
were no last names.
Yeah, isn't that because Scottish and Irish people, they have let's say what's a popular Scottish last name?
McMillan. I don't know. I just made that up.
Let's say for the sake of McGregor.
McGregor.
No, McGregor's.
He's
Irish.
McGregor. No, I think McGregor is Scottish.
Okay, we'll just use McGregor for example.
Let's pretend it is.
I think that's just a clan, and then he had the name.
Yeah.
So it wasn't so much the family name; it was the clan's name.
That's like being Irish myself, with the surname of Gallagher. All the Gallaghers originated from Northern Ireland in County Donegal. Go figure. So you can go back. That's where we derive from. My grandmother, great grandmother, the one I said that came over as a servant to her family, her maiden name was Cronin, Cronin. Another Cronin. Very, very Irish name. Her mother was Curtin, Curtin, and they were both from, those surnames are both from County Cork, which is the southernmost of Ireland. Beautiful, beautiful, beautiful part of the world. But those two surnames, so that's where they're from. If you have somebody who's from this region, that's where, you can go back as far as you want to go back. That's where they all originated. Part of the genealogy thing that I think has made it very interesting, and my science mind loves it, is the DNA. Pretty cool. So I recently did my parents' DNA, did that a year ago, did my DNA, and as far as the Irish stuff goes, it even put us into a clan, which is pretty unusual, because I've done a lot of people's DNA as part of their genealogy, family research. I haven't seen anybody else come up with a clan. That's kind of cool.
The clan.
With a C.
With a C. Not the K.
No.
Yeah, I did my I did that 23andMe.
Yeah.
And they did the genealogy, the DNA genealogy. They said basically what I knew was that like 60% Southern Europe, so Spain and Portugal. I think 30% Native American, so that's going to be the Puerto Rican or the original tribes that was there. Then African, which because Puerto Ricans are mixed between the Spaniards, the Native Americans, and slaves. It's West Africa. So I'm like, oh, that's interesting. I'd like to go see West Africa one day.
Yeah.
Yeah. Well, one thing I was kind of disappointed about. I thought I was going to have Middle Eastern.
Because
people keep saying, I mean, even my family says, like, I think you're Middle Eastern or you're Indian.
No.
Yeah, a lot of people say that.
I would have never guessed that, by the way.
Well, I don't know. I get it a lot, so I thought it was
Oh,
going to
when
be
you said
some
Portugal and Spain, all day.
Yeah.
Yeah. Easy. I can see that.
Well, it kind of depends what part of Spain too, because if you go to the eastern part of Spain, then you have the Middle Eastern
Yep.
influence there.
Mm-hmm. Right.
The what was it called? The Ale. Oh my god, I'm to go see it. The Alhambra.
Mm-hmm.
Beautiful.
Have you been there?
Mm-hmm. It's very beautiful. I stood at a hotel right across from it. It was gorgeous, and it was really just breathtaking. Like they built this fortress, this beautiful fortress on a mountain, and he oversees Granada.
Wow. Oh, I love
Then
traveling.
you have the Spanish. You have the mix of the Spanish food and Middle Eastern food, and you see in the art and the architecture.
Have you been to Morocco?
Well, I wanted to go there.
Morocco.
Oof, Morocco.
I know, right? Near Spain, right across the.
You just have to take a ferry.
That's right. I had friends who lived there. They always talked about how nice it was. They lived in Fez. So.
All right, this is the question part of the interview.
Ruh-roh. I thought we already had questions.
No, this is the one that for anyone that's a first time listener. This is these questions I ask. The reason these are more interpersonal questions. The reason why I ask these questions because I have a lot of guests on here, and sometimes some of the people I have on here you may want to disagree with or may find unfavorable what they do. The reason for these questions is that they show a different side to a person, a more intimate side. The reason why I do this so that way you could disagree with a person or you may not find them favorable, but you could relate to them to a certain degree. And some of them are serious and some of them are really fun, but all of them, like I said, show a different side to the person. So we'll get started.
Yeah, let's do it.
Given the choice of anyone in the world from any time period, who would you want as a dinner guest and why?
Wow. Huh. Probably. Okay, this one's probably so easy for me. It's between two people, so we're gonna go with Mary Teresa Curtin Cronin, my great-great-grandmother. She died in 1928.
I thought when you said Mary Teresa, I was thinking...
Nope. Mother Teresa?
No, yeah, Mother
That'd
Teresa.
be cool, too. But she's quoted a lot in history, so I feel like I could derive something from her without having to have dinner with her.
Mm-hmm.
You know what I mean?
Yeah.
She's well documented.
Mm-hmm.
But it would be her.
Why her?
I recently got photos of her from my dad's sister, and it made her... It's kind of like these questions and your whole point of the questions. It made her very human to me. It made her very real to me. And what I would love is to sit down with her and talk to her about her journey from Ireland to England. Why did they leave? What was her story? I don't know. Seriously, that would be the person I would pick. And like I said, I recently got photographs of her children, and I know who I look like. I totally know. Well, I always knew I looked like my dad's side of the family, but this is proof positive, y'all. Yeah, I'd want to know her journey. I want to know her story that nobody has told.
Does she come back here to America, or she just left?
She stayed there.
She stayed there?
She died in England in 1928.
What part of England?
London, Poplar.
Oh, okay. Oh, wow, London.
Yep. Poplar, where Call the Midwife is filmed. Yeah, so.
Call the Midwife. All right. What would constitute a perfect day for you?
Oh, man. Perfect day? It would involve being on the water. Kayaking, probably. 70-something degrees. Yeah.
Simple.
Yeah. I'm
That's it.
not a difficult person.
It's like, okay. I'll just pack a
That'd be
lunch
good.
and like, yeah, go to water.
Yeah. Pack some snacks. So, yeah.
Right. Do you have a secret hunch on the way you will die?
Who, me? A secret hunch? No, I have friends that do, and I think it's weird that people do.
Mm-hmm.
I want to be surprised, I think, you know? So, no, I don't.
Yeah, it's yeah, I kind of want to be surprised too. I don't
Yeah, I
want to
don't
know
want
what's
to be
coming.
holed up in a old folks' home, y'all. Kids, if you're listening, be
Yeah.
nice.
Yeah, I don't want to be held up in a
Or maybe I do. Maybe I'll be that person. You know what I mean?
Well, it's like if it's a nice old folks home, but I don't want to be stuck to a
right?
bed. Like there's nothing else.
I will ghost you when I come back. Be nice. All right. I don't.
If you could change anything about the way you were raised, what would it be?
Oh, man. Well, I will say that I wouldn't change anything about my past. The good, the bad, the ugly.
Mm-hmm.
Because that's who I am today is based on that. But if I have to answer that question, I do have an answer. It would be, I think there's a group of people I would treat kinder. That I was influenced by some not nice people.
Hmm.
And they were mean to me too, so. But as a teenager, you do things to be accepted.
Yeah.
And I probably wouldn't have done or said some of the things I did, which is real interesting. Recently, I became Facebook friends with one of the girls that I hung out with as a teenager. Like I said, I don't really know that the girls didn't. I don't know that they really liked me, but I was part of the group. Got along with the guys. We're just neighborhood group. And the other day, it's been about a month ago, I posted something on Facebook, and she private messaged me, and she goes, I wish I could go back in time. I was so stupid. You're such an amazing person, blah, 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 blah. Mm-hmm. And I cried because she was so mean to me. She was terrible. Yeah. But I still was her friend. I still did what I had to do to be accepted into that group. But it hurt, you know. And so anything that I did along those lines, I'd change that. Just be kinder, you know.
Well, especially at that age, it's like, how much do you don't really know a lot at that age, and then you had to deal with growing up, the social acceptance. And,
oh yeah, it's a big deal at that age.
Yeah, I was the other day I ran into this senior from high school, and it turned out we both went to the same high school, and how embarrassing this is gonna sound, my freshman year of high school, thinking it was a good idea to pick up women, I joined the cheerleader squad. I did that for a year as a male cheerleader. Didn't work. I got bullied pretty badly. I had to get in a couple of fights just to people to leave me alone.
Yeah.
Just to show them off, like, okay, I'm not someone to mess with. I was talking to the senior about that. He's like, man, it's funny because all the guys who are on the male cheerleader squad now, they get laid a lot. I'm like, what?
Did it backfire on you, Frank?
Hopefully I paved the way for them. Please let my sacrifice mean something.
Sacrifice to the cheerleading.
He's like, yeah, those guys get a lot of girls. So like, what?
Your motives were not pure, or were they? Wait,
he said like, yeah, their motives are the same thing. They're like, yeah, they want to get women. Oh man,
that's funny.
If you wake up tomorrow and gain any power or ability, what would it be and why?
Any Power. Wow. Like superpower?
Yeah.
Superpower.
Be anything you want.
Anything.
Mm-hmm.
Can I have the cloak of invisibility?
Yeah, sure thing.
I'll take it. I'll take that. Because sometimes I just, I don't know. I like to get quiet, if that makes sense. I like my music. Which isn't quiet at all.
Mm-hmm.
So, yeah.
Got the cloak of visibility.
Yeah, just so that I can just kind of hide. That's why I like to go to the beach a lot. I'm not a big swimmer or water person, but there's something about being out there and just to be, quiet, alone, just get away from the world for a moment. I don't need to be gone long.
Yeah.
But that's why the cloak of invisibility would be awesome, because I could put it on, give me 10 minutes, take it off. Hey, I was here, Yeah, just to kind of re-energize or whatever.
I remember reading in the news that scientists were working on, I'm not sure if they're still doing it, but they were working on a cloak of invisibility. They were able to make a tiny, it was super tiny, it was enough to cover a flea.
Dang.
It's like they made it flea invisible, basically.
Oh, to be a flea. No, I'm just kidding. So I have to ask you a question now.
Mm-hmm.
What's the most popular answer for that question?
I think it will be this flight. A lot of people say flight, but the one that the first time I asked that question was to my old cop buddy, and he's a big comic book nerd.
Oh.
And his answer was actually pretty epic. He said, if he would have the power that anything he says will come true.
Oh, no.
He said, he's like, I thought about this.
Doesn't drink.
He's like, I thought about this. That's my answer.
Thought long and hard. Well, I'm a pilot, too, so
Oh,
I
really?
need to fly.
Are you,
I'm not flying right now, but...
What type of pilot are you?
A single engine.
Ooh.
Yeah. Mm-hmm.
I thought about doing that. How much did that cost to do that?
Well, I was fortunate because my friend was a pilot, and he had his own airplane. So, yeah, I bought the books and trained myself on the ground school stuff. I didn't go to school.
Wow.
Just self-taught, took the written test, and he got his instructor rating. So,
oh, sweet.
I know it was pretty bonus, but it's been a while ago. I don't do it anymore because he's not around to do it. But yeah, so I wouldn't choose that, but I'm going to stick with the cloak of invisibility. Although I'm thinking about what your friend said about words coming. Nah, I don't want that one. I can be pretty. Yeah, no.
That's a pretty big superpower right there.
That's like a big responsibility. You have to watch what you say.
Yeah.
Think about it.
Say something in anger, something bad happens.
I know, or jest. That's my thing. I joke too much.
It's like, no, I didn't mean that. I didn't mean it like that.
Oh, not a bean. All right.
What conspiracy theories do you believe in?
Ooh, believe in or believed in? Because I'm not sure I believe in them. Well, do we have to name names?
No. Some people, for this answer, they say Bigfoot or aliens.
Oh, thank you.
So stuff like that, or it could be like a serious ones. It's like, yeah, I believe JFK was assassinated by the mob. So there's some people
I
who
don't
would
think
say
it was
that.
the mob, but go ahead.
No, it's like, it's whatever you...
I know. But you're trying to confess something to me. Because I read one of your stories, and there's such... the one I told you about.
The execution.
Oh, my goodness. Yeah. I know what your inspiration was for that story.
Well, it's like... law...
Let's just say.
If anybody has not read it, it's on the website under the story section.
Please read it. It's so good.
Actually, I was talking to my friend about it. Like, I want to do a sci-fi or a time travel story, but a morality story.
Yeah.
Basically, it's the time travel is the what do you call it?
It's the premise, really.
The premise, but the actual plot to it is a morality tale.
Oh yeah, it's amazing. It makes you think. But also makes you think about conspiracy theories. So there's that. And back to JFK and what happened?
Yeah.
No, I mean, seriously,
Actually,
after you read something like that, you're like,
actually, part of that,
whoever's listening to this just needs to go read it right now.
Actually,
Pause the podcast, go read it.
Some of that story was inspired. I didn't read the book. I saw the show on Hulu by a Stephen King story. Mm-hmm. So it was partly inspired by it. And actually, I did make a little what do you call it? A little Easter egg in the story for Stephen King, because the prisoner number was the title of the story. So that's kind of like a little shout out to him for
nice.
like just like he's like, oh,
little Easter eggs,
just like kind of like that part of the story. The inspiration was from that story.
Yeah. Oh, that's even cooler. Ooh.
Yeah, a lot of the stories I write, I like
trying
to put.
To avoid answering his question. Y'all.
Yeah.
Conspiracy theories.
Yeah. What conspiracy theories do you have?
Did Area 51 close down during the government shutdown? Because I want to see it.
No, that's a government. that's. I think that's funded by the military, and the military's on a different budget.
Whatever. I know. I may or may not know stuff about that. Okay. Anyway. What?
Okay.
No.
So no conspiracy theories.
No. It probably. Yeah, I think there's other life out there. Totally believe it.
Yeah, like I don't
believe it.
I don't think it's. I wouldn't consider that conspiracy theory. Only if you believe.
There's so many movies out.
No, only if you believe there's like UFOs. Like, oh yeah, we've been visited. I'm like, okay, I think that is a conspiracy theory. But the whole idea, like,
well, you're the one that brought it up as a
Well, like, no, I think there's life out there because the universe is too
vast.
Yeah, too vast for us just to be here.
All right.
So I think that's kind of like more rational. Like, yeah, there has to be someone else.
Okay. Well, then we're gonna go back to Lincoln. Seriously.
What's the conspiracy theory with Lincoln?
I think that Booth may have shot him, but yeah, no, it was national treasure. You know, come on.
National treasure.
Oh my God! Go to the next question. That's ridiculous.
Okay. When was the first time you fell in love, and how did it happen?
Oh gosh. And by romantic love or like fell in love in general?
Well, that's up to you.
Theory. Yeah, because
actually, give you a good example. One person, and she texted me the other day. She actually had a really mature response to that. Mm-hmm. She said, like, well, basically what you just asked. Like, this is the first time where I felt like kind of lustful love. Like, I didn't really know what at the time this. It was just like I thought I loved the person, and this is the time where I actually fell in love with someone. Like, oh, this is what love is. Mm-hmm. So whatever.
Oh, and I was thinking more like just love as the emotion.
Oh, okay. Let's go with that.
Yeah. This is so dumb, but so how old was I? Maybe 6. Mm-hmm. And we lived in an apartment building. I'm from the DC area. Lived in an apartment building, and I remember coming home, walking down the hall, and my dad was walking down the hall, and he had just been out of town and come home, and he said, "There's a surprise in the apartment for you." And he said, "It's a big." He didn't say big. He said, "It's a black surprise." And I was like, "What could it be?" Well, we had never had a pet. And I came in, and under the Christmas tree was our little dog, little black Chihuahua, Tiger. And I remember just this emotion of love for this pet. I don't know. It's weird. Yeah. But as far as lustful love kind of emotion, which is probably really what you were trying to ask me. Yeah, like March 19. Let's go give you a date. Yeah, this guy named Ray. Yeah.
How'd you guys meet?
He was my brother's best friend.
Oh wow.
Still is. Yeah.
Oh, so yeah. It just didn't work out.
Yeah, it didn't work out at all. 40 years later. No, I'm married.
Married. I'm married now.
Yeah, I'm married to him. No, seriously. When I was a teenager, the first time I saw him, I knew he would be the one. I just knew it. Oh, yeah. Absolutely. He didn't know it for like 5 years. So I was like, okay, I'll just wait. He's like, you're just my best friend's little sister. And I was like, okay. Fast forward. We're still together.
Wow.
Yeah.
Oh my God.
It's been forever, though.
Yeah, I'm keep hoping for something will happen like that will happen to me, but
Maybe it has.
no,
and you're just not conscious of it yet. That's another podcast, but that would be interesting.
what find a woman that
Yeah.
there was a woman.
Uh-oh.
When I worked on the cruise ship, I realize now I grew up a lot now, even that was a few years ago, like how much I kind of like more matured with the idea of a relationship.
Sure.
But at the time I was afraid to ask her out. I think it was for stupid reasons, like
rejection.
Not only that, but like I wanted to play the field because I just came out of I came out of a bad relationship. I was just
burnt.
Yeah, I kind of burnt, and we always said hi to each other. We always kind of gave each other looks, and she was Romanian, and she was going to go on her vacation for a few months from the cruise ship, because on the cruise ships you work a couple months on and a couple months off. So then I found out she was leaving, and I left a note on her door. She came and hung out with me, and this is a time after I came out of a really bad relationship with someone I thought I was going to be married to for the rest of my life. We never had sex. It was just the idea that she laid in bed with me, and the stuff she said to me made the world a lot better for me. And then a year later, when I left the cruise ships, we met up again when she was in port. We spent the night in a hotel and made out and stuff, but we never had sex. And it was just a
connection without.
It's something like when you're kind of like single for a while, and you start missing that connection, and it's nice to feel that.
I think we crave that in human relationships, and not the necessarily the sexual component. Like when you asked me about love, love comes in so many different
different shapes, different sizes,
absolutely.
different people.
Different.
Yeah, best friend love. Like, oh, this is my best friend. I love her. Or then you have, I love my child, my dog.
I mean, the English language is so messed up in that we have one word for love, and yet we have so many different meanings. I love pizza. I love my dog. I love my husband. I love my children. And yet they can't possibly mean the same thing. Well, maybe about the pizza, but, it can't possibly mean the same thing. But other languages have numerous words to identify more specifically what the love is. So like Greek, for instance, the word for Philadelphia is that brotherly love. The word eros is an erotic love. And then there's the God love, the agape love. There's numerous ones. I don't know how many there are, 7, 8, 9, I don't know, a lot. And so it's hard for us to be able to understand, but we have to qualify it all. I understand what you're talking about with her. It's not in super, super intimate, personal, but it is.
Yeah.
And you have to qualify that by saying, well, there was no sex, but there was an intimacy that is probably even more important in human relationships. And when you don't have that intimacy with someone, it can be a lonely world.
Yeah, and what I found out, especially with sex, like sex is nice, but it's not, it doesn't satisfy you like a connection does.
Because it's temporary in the processes of it. But the hormones that connect us with someone else, like oxytocin,
Yeah. The feel good molecule. Or
it's the love
Yeah.
hormone. And it is the hormone that's released during orgasm.
Mhm.
But it's also the hormone that's released in a hug with somebody. And it's not just a sexual thing. It's a feel-good, a connection with somebody hormone. By the way, that's the hormone that's released during labor.
Really?
Yeah. How about bringing that full circle?
Oh, wow.
Mm-hmm. Yeah.
Probably need a lot of that.
Yeah.
Like, give me a whole bunch of that
cool.
stuff.
Well, that's what causes the uterus to contract.
Wow, really?
Yeah. And so who's getting the oxytocin? The mother is, causes the uterus to contract.
Mhm.
But the baby is right in the middle of this flood of oxytocin.
Oh, wow. That's
okay.
deep.
This is going to get deeper, and we'll get to the rest of your questions.
Yeah, well,
but
that's deep.
how many hours do we have? No. But also, I'd mentioned earlier that endorphins are released, which is a morphine-like chemical that gives you a sense of well-being and a sense of euphoria. It's the gate run, the gate run, whatever it's called, the marathon where you get on the heart.
Oh,
bridge.
runner's high.
Yeah.
Is that the runner's high? Like when you break
Yeah,
that when you break that
runner's high.
when you
When
break that wall.
Push through. You don't think you can do it. You push through. Endorphins are released. It's euphoric. And it is a morphine-like chemical your body releases. So a woman who's giving birth has the oxytocin, that love hormone. She has the endorphins at a certain point of the labor when it becomes intense. And then this little critter is inside of her, little baby, who is also getting saturated with the endorphins and the oxytocin. So when that baby comes out, on a cellular level, and this is why birth is so important, and preserving the birth process, it's feeling of well-being, falling in love, feeling of well-being, falling in love, warm, wet baby right on mama's chest, and they're both doing this inside of them in a way that they can't even comprehend. And that is what connects one generation with the next. So, back to what you were talking about, this connection with another human being. And it's really what you do, Frank. This is all of what you're doing, is connecting other people with other people for that euphoria, for that relationship, for the human connection that is so critical and so vital, especially in our world that we live in, where we don't have that anymore. When a woman is in labor and she has medication, this is not anti-medication because there's a good place for it.
Yeah.
Epidural and whatnot. There really is. But she no longer needs the endorphins. She no longer maybe even produces the same amount of oxytocin and maybe needs a synthetic version, Pitocin. It's not quite the same. You can trick the uterus, but can you trick the brain? Maybe not. And so we miss something. There's a gap that's missing, and I think that as it is or can be in childbirth, it should be in every relationship we have. And it's just not about birth, and it's just not about sex, and it's just not about whatever. It's about all of it. And it's so important and so critical. And that moment you had with this Romanian woman is like something happened to you.
Yeah, see, there are two women in my life. The two women I will say in my life who I probably had the most intimate relationship with were women that I only met for a briefest moment in my life. And they were the ones who had the most impact. The one who had the most negative impact was the woman that I was deeply in love with. But she, I think I matured from it. I had to learn a lot, but there was a lot of pain that came with it. A tremendous lot of pain and mistrust after that. But like, no, it's strange. Like how much kindness, why kindness is so important, or just that one moment you may not know, like just that kind night you have with a person. You may never meet that person again, but you don't know what the goodness that what's the word for it? Reverberates. Is that the right word?
Reverberates.
Reverberates.
I think if that's what he wants.
Yeah. Basically, just cascades out from that moment.
Yeah, it's the repercussion, it's the ripple effect.
Yeah.
It's the continuity of that feeling or that moment.
Well, yeah, you might have changed a person's life, or you may have not known it.
Well, that's when you asked me the question if I could go back and change anything. And then the profound effect that gal had by apologizing to me, essentially, a month ago for stuff from our childhood. It affects us, And so, so you give $5 to the homeless guy who's probably scamming people. Maybe he's not. Maybe he's not. Or, you meet somebody at Bearded Pig and you ask them about their tattoo or whatever. You
get a story out of it.
Yeah, you get a story out of it, right? But, no, and it does affect us, but we have to be conscious about it, and good and bad. So
yeah, definitely bad because
well, the gal who
like
broke your heart.
One thing I'll say, like, this goes to both sides of the relationship, men, women, or if you're gay, men, or women, women. It goes to both partners, and if the relationship is not going well, if you're not interested in a person, then the best thing is just be honest and do it in a way where it's amicable. Just like, okay, this is not working. Let's do our best just to separate the best, where it's not going to be harmful. It's going to hurt, but at least less hurtful.
Yeah.
With my situation was that she lied. She did a lot of bad things. Mm-hmm.
But there are some people, and it's just, I wish it was possible to live in that world. Mm-hmm. But if it was, you wouldn't have written that wonderful story that I talked about earlier, the execution. Mm-hmm. Guys, really read it. Because it presupposes that everybody's capable of being good and making good moral, ethical decisions. And the truth is,
not everyone's the same.
Not everyone is the same.
Yeah.
But we have a responsibility as an individual. If you can walk away from a relationship and say, I know I was as honest as I could be without tearing somebody apart. I was kind and generous, then it shouldn't matter what that person did to you. Shouldn't be on you,
Yeah. And also you gotta remember too, like, don't use your pain as a justification.
Right.
I think thankfully I didn't do anything too bad. I think I may have just made some mistakes because of the pain, but I never, at least I could say for certain I didn't do anything sinister or malevolent. Mm-hmm. All right, let's move on to the next question. Yeah, I got it pretty deep.
Yeah, I like it.
What are your deepest held beliefs?
Well, I think we know what that is. Family. The core of family. And obviously that can mean anything to anybody because for some people it's not blood related. But it's having a core group in your life of people that you can be whoever you are to those people, and they will love you and be there for you no matter what. Unfortunately, sometimes, especially with what I do as a midwife, I hear stories about how family treats some of the women I care for. I was thinking about somebody particularly many, many years ago when I first started. And it just, they were disappointed. She was unmarried. They were disappointed because they didn't approve for whatever reason,
Mm-hmm.
of the gentleman who was the father of the child, whom this woman loved. And so they ostracized her, pushed her out. And I'm like, that's not family. That's not what family does. Family loves you no matter what.
Mm-hmm.
And like I said, family doesn't have to be blood. It doesn't have to be the people who bore you out of their loins. You know, they can be the people who take you in and say, I will love you no matter what. You can't do anything that's gonna make me not love you anymore.
Yeah, and also coming from experience, because I didn't come from a good family either. Sometimes the best thing you could do is walk away, and like it may be like the most important thing you may have to do in your life. And people that say that they love you, but then they're hurting you. You walking away is probably the best thing you do, where you can find someone that actually loves you.
Yeah, and it's hard to find your tribe, to find your group if that's
or find
your
like
situation.
the actual family that you need.
Yeah, for us it came pretty, to borrow your word, organically. It just happened that my husband, we met him because my brother met him because he was in a foster home that put him in the same school district.
Mm-hmm.
You know, he was raised in orphanages and foster homes, and didn't have that family. You know, my mom took him in. My dad was okay with it, but I mean, like, seriously, my husband is my dad's favorite son, and he's got other sons. It's kind of a joke we have. He loves Ray more than he loves anybody else. I think he loves Ray more than he loves his own daughter, but
I like him better.
Right? But no, so that put us in a place where I mean, I joke about it, and I call our home has always been the land of misfit kids, because we know what it's like to not fit in somewhere. And so I have a number of people in our life that, you know, we've taken in, so to speak,
Mm-hmm.
you know, and they are our family. They're our sons predominantly, you know, they have their own families now, but, you know, these are kids that we took in when they didn't have anywhere to go. They didn't have anybody, or maybe they did have somebody, but they just weren't getting along with mom at the time. And it was like, come here, stay here, you know. We created a family for these kids. You know, that's what we do. Still doing it.
I remember my college professor said the only two types of people who deserve love without earning it is children and the elderly. And so, like, everyone else, you gotta earn it, but sometimes those are people, like, you have to give it to them. You just have to give it to them.
Yeah. I don't know that, I have to think about that one, because I almost want to say I can't completely agree with that.
What part?
That only those two categories. I think that everybody deserves it, you know,
Okay.
without earning it. Because but for me to love somebody and to show that I care, is on me. If I'm doing it to get a response or something back from somebody,
Oh, okay. Yeah.
then maybe they do need to earn it.
Yeah.
But that's not how I work. No. I will reach out and care and take care of people, not for what I get in return, but how I feel when I do it. It's probably a lot of oxytocin is probably what's going on here. Something, you know, chemical, for sure. But yeah, I do it because I care, not because I want something in return. And I think that's hard for a lot of people, because societally we are expected to give something in return for a gift, or even though we're not supposed to be.
Sometimes,
a gift is a gift.
yeah, sometimes doing a nice thing is a reward on its own.
Yeah. Yeah.
Yeah,
True.
we need more. We need to go back to that mentality.
And I think that would be a good place to be. But I think too many people probably are burned by it, you know?
Yeah. Yeah, there are.
Take advantage of somebody, but it's not my responsibility if I give the homeless guy $20, which I hardly ever do that. I did it the other day. I don't know, something in me just felt like I needed to do that for this person. I don't know why. I don't have any reason logically to tell you why. Other than I was just sitting at the traffic light and I was like, today's his day. And it's
you gonna make it his day.
My benevolence to this guy with, I don't even know his name. I don't care what he's going to do with it. It's not my problem. My problem is listening and going, am I supposed to help this fellow human being? Mm-hmm. And there's probably people listening to this going, well, that's stupid. What if he went out and bought alcohol or drugs? Or that's not my problem. I was supposed to help a human being. Mm. And what he does with that is that's not why I did it.
Yeah, it's like...
I don't qualify to somebody my gift. I give you a gift. You do with the gift what you will. Mm-hmm. You know? That's kindness, I think.
Yeah, it is. It is, there's this joke I remember somebody telling me that there's this man, there's a flood and this man is on top of his roof, and I know I can see that you just give me the head now, you know about,
please.
But I'll just say it just for the audience. There's a man on top of a roof and the whole town is flooded, and his neighbor comes by with
he's not on the roof yet.
He's not. Okay, never mind.
He's on his porch.
Okay, there's a flood coming, and his neighbor comes by with his pickup truck and said, like, hey, won't you get in the pickup truck before the flood comes, the rains? And the guy's like, it's okay, God's going to save me. Yep. Now, the flood came. He's on top of his roof. There's another neighbor who stuck around, but he had a boat. He came by. He's like, hey, jump in the boat. We'll get you out here. And he's like, it's okay, God's going to save me. And then a helicopter comes. And so I was like, hey, we're going to draw you down the line. We're going to pick you up. And the guy's like, it's okay, God's going to save me. The floods get worse, and the guy drowns from the flood. He goes to heaven. He's pissed off at God, and he's like, God, how come you didn't save me? And God's like, what are you talking about? I sent you 3 people to pick your ass up.
You turned me down 3 times.
I sent you 3 people. Well, that's like what you kind of like what you said. You know, that might be the same situation to the guy. Like, and there's some people who will take the first guy in the car or the guy in the canoe. It's like, oh, maybe this is the time I should change my life. Or maybe the same thing. It's like, oh, well, I got the $20. Like, maybe I should.
I don't know.
Get some food and.
But just, I mean, like the guy in the pickup truck, the guy in the boat, and the guy flying the helicopter, they just did what they were supposed to do.
It was up to the other person.
His death wasn't on their hand, you know. They just did what they were supposed to do.
Yeah. They were given an opportunity, and it's still their choice. Mm-hmm. All right. We got a couple more questions.
You can pull the string on that light.
Oh, okay.
It's getting dark in here. Or not.
Oh, I unplugged it. It's okay. I have unplugged it to plug the equipment in. Yeah. We'll do 2 more.
Sure.
What is your most treasured memory?
Oh my gosh. The birth of my children.
Yeah?
Yeah.
How many children do you have again?
4.
4. Okay.
Yeah.
You said the first one was in the hospital. And the other ones were...
out of hospital. Yep. Yeah. The birth of my children.
It's a powerful...
You hear that, kids?
It's a powerful experience.
Yeah, it is. It's made me who I am.
And I'll see, here you are.
I know, right? Helping people have that beautiful experience, y'all. Yeah.
All right.
That was easy. I thought you had another question.
No, this is gonna be the last one.
Oh man.
This is the question that's it's pretty serious, but I ask this one to everyone, and I always leave this one for last. It's a 2-part question. What is the worst thing you have ever done in your life?
Mm-hmm.
And what is the best thing you have ever done in your life?
The worst thing I've ever done in my life. Dun dun dun. Is it bad? I can't even think of anything, so it can't be that. I gotta make something up.
No.
No. Probably. God, I can't let them hear this if I'm gonna confess that. Yeah. No, I'm not gonna say that. The worst thing? Maybe I should go the best thing first. Could you rephrase the question? No. I'm trying hard to think of something that the worst thing I've done. I mean, I want to say, lying to my parents or, not lying to the kids, because I think as parents we do that to protect them. But, yeah, probably some of my behaviors when I was a teenager. Did a lot of drugs and, yeah, it's probably the worst thing I did. I mean, the thing that I regret the most. Taking drugs from my parents. My mom. True confessions. She's not going to listen to this. God, if she does, never mind. Guess we're not editing that out. Yeah. So when I was in my teen years, I did a lot of drugs. So I'm just lying to my parents about that. But I feel like my dad probably knew everything. My mother knew nothing. Pretty sure. Well, one time I remember her and I had, we were eating lunch together. I think I'd had my second child by then. And she just made a comment that how I was such a good teenager, a good girl. Was such a good girl and not like the other girls that I hung out with. And I'm like, yeah, I was such a good girl, Mom. So, we won't tell my mother about the podcast.
Okay.
Her name is Susie. Her name and all. And then probably, how do we phrase that second part?
What's the best thing you've done in your life?
Oh, best thing I've done in my life? Well, I think that's, raise some good kids. They're like amazing kids. Really good human beings. Good adults. Kind, generous, good people.
Yeah, when I hear something like that, I'm on question when I'm going to have kids. I know that it's a scary responsibility, but also the people I talk to who have kids say it's also the most joyous thing they did too.
Yeah. For me, I remember, like I said, I was so young when we had our first kid, and I remember I was fortunate to be able to stay home with him, and Ray went to work, and I think Chris was probably about 3 months old, and I remember Ray had gone to work. We were laying in bed, and there I am with this little baby, and I was just overwhelmed, completely overwhelmed, as my brain started going into, who am I, this teenager, raising this baby? How am I going to keep him safe, and how am I going to provide for him? How are we going to make him, give him everything he needs and whatever? And then as I was thinking that, like, exponentially, and my brain was just like, how am I going to, the toddler, the school-age child, a teenager, an adult, and in my brain it was just just a whirlwind of thought, and who was I, this ultimate responsibility on me to parent this child, and I don't, we haven't talked much about, spiritual things or God. I believe in God. I believe, not sure how it all works or anything, but I feel like in that moment, my brain just became very still and very quiet suddenly, like, like there was a tornado and then bam, it was gone, done. And in that still quiet moment in my head, I heard, you only have this moment. And normal me would have taken that as, oh my God, he's going to die, in the next breath. Because I'm that mom. But I didn't. I had absolutely no fear whatsoever. And I realized at that moment that it wasn't the teenager who was going to be parenting the toddler.
Mm-hmm.
It wasn't the teenager who was going to be parenting the teenager.
Yeah.
That I would grow with him. And that we would, I would
figure this out.
Yeah, totally figure it out. But so my revelation in that moment, and it's what I pass on to patients when they too, or even people like you who just are potentially overwhelmed by this idea of parenting, is you just have a moment and you just parent for that one moment. And if you mess it up and you're lucky enough to get another moment, you can fix it. But it makes us very conscious about parenting if we do it just for that moment. What kind of an effect am I going to have when I say what I say to my child, and, that sort of thing. It was the best lesson I could have ever gotten. And it was such a young person at the time, to get it. But I think my kids are lucky that I heard that message. And I was not I've made mistakes, don't get me wrong.
Yeah, of course, you're figuring out.
But I got the next moment, y'all. They're still here.
They're still here. They're still alive. Oh my God, they're still good.
Right?
I did something right.
But that's my encouragement to you, that one day, if you're so lucky, you'll have that moment too. And that you'll remember that.
Yeah, I gotta find the right girl first.
Well, that kind of helps, since you don't have a uterus, I don't think. Do you?
No, I just got testicles.
There you go.
the male plumbing.
Yeah, that's right. They don't. Well, never mind. We're not going to go there.
Oh yeah, that's not. Yeah. Well, yeah, they're not plumbing, but.
I mean, sort of. I know what you mean.
Yeah. All right. Go ahead and start ending it. So tell the audience if somebody wants to get in contact with you, or if someone's interested in midwifery.
Oh my God.
Midwifery, or interested in having a home birth, or interested in general just about the profession.
Midwives, yeah.
And even your genealogy research. How would somebody get in contact with you?
Sure. Probably the easiest way to get a hold of us here at Fruitful Vine Midwifery Service is our phone number, 904-855-4211. We have a website, fruitfulvine.com. That's kind of informative. Facebook is always a good place to go. Mm-hmm. Fruitful Vine. You can search it, Google it, everything. It's there. The genealogy is pretty new, but I do have a Facebook page. Mm-hmm. The past is a present. How clever is that? Like, your past is your gift, my friends. So you can find me on Facebook. The past is a present. And get me there.
All right. I want to thank you for doing this. It was a really fun episode. Anyone that's new listeners, don't forget to subscribe. Come check out the website, atabloolife.com, where you can read some interesting articles, short stories, poems, and prose. And if you really liked it that much, send me an email or leave me a little tip at the tip part of the website. Thank you guys again for listening, and listen to more episodes in the future.